Today I want to talk about where the money goes as far as the dollars raised from the American Cancer Society and how we spend them as an organization. I think it's really important to know all these pieces and how they all fit together. So the American Cancer Society is the official sponsor of birthdays, and we want people to celebrate more birthdays. And we accomplish that by helping people stay well, helping people get well, finding cures, and then giving people an opportunity to fight back. As an organization, we do focus on all types of cancer, so it is a distinction between us and many other organizations out there that we focus on all types of cancer. And we also take a unique approach that many organizations who focus on disease take. And if you look at any disease, if you look at diabetes, if you look at Alzheimer's, you look at cancer, it's multifaceted as far as the approach that organizations take to battle that disease. So any approach to any major disease, you've got education for those people to know about the disease, to know how to prevent it, to know what to do once they get it. You have services for those that are impacted by the disease, so those direct services for people with the disease or dealing with the disease. And then you also have research to end the problem. We can continue to provide services all the time for people every day, but if there's no one doing research to end the problem, then we really don't get anywhere as far as moving with the disease. So when it comes to education, services, and then the research to end the problem, the American Cancer Society takes all those approaches when working and battling cancer. And also we take a systems approach. So years ago, we used to approach the population in general as far as our prevention, early detection initiatives, just small groups at a time. So we would go to a corporation, do a lunch. Anybody that wanted to show up that day and bring their brown bag lunch on their own would do that. So about 5 to 6 people would show up, and we would talk about the need for mammography, about breast self-exam, about colonoscopy. We approached that, our early detection and prevention initiatives, in a way that was just a few people at a time. And we realized as an organization that in order for us to be effective and to really impact the population as we needed to, that we needed to take a systems approach. So everything that I'm going to talk about through this presentation really talks about our systematic approach to where we can impact a system and have a major impact on thousands or millions of people at a time just by impacting that system. So that's the approach that we take as an organization. So when it comes to helping people stay well, that's our prevention and early detection initiatives. The goal there is to prevent people from ever getting cancer, or if they do have cancer, that there are systems in place for the major types of cancer that we can potentially detect it early, especially with breast cancer and colon cancer. So early detection and prevention, or how we help people stay well. We also have a new kind of cross-cutting initiative that we're working on in the prevention and early detection area is the obesity initiative. And nationwide, if you look state by state, and you look over the last 20 years, the percentage of the population that is obese or overweight has grown dramatically. In some states, almost 60% of the population is obese or overweight. And so we know that through our cancer prevention studies, one of the internal research initiatives that we've done, there's a link between obesity and cancer. And that's a proven link that we've done through research. So now as an organization, we have a new initiative, and it's really looking at how do we address the population, especially that group of individuals that are obese or overweight. And as an organization nationally, our National Board of Directors has just recently set the first outcome to at least to stop the rate overall nationwide by state of those individuals becoming obese. Now, we haven't figured out how to do that yet. So it all starts with setting our objectives and setting our outcome, and now we'll apply research and research dollars to looking at that population or looking at individuals in general to educate them on the importance of maintaining a healthy weight and a healthy lifestyle. Tobacco control under prevention and early detection is probably one of the most well-known things that we do as an organization and that we've done for many years. And truly, if we look at tobacco control, looking at smoke-free workplaces, looking at all of our advocacy initiatives for smoke-free workplaces, smoke-free states, being able to all public places being smoke-free in many states, all that's because of the American Cancer Society's advocacy initiatives that we focused on for several years. And if we look at smoking cessation, we really want individuals, we want states to provide smoking cessation services, as well as corporations to provide smoking cessations to their employees as a piece of their health plan as well. And then also looking at the tax. So if we know that by increasing the cigarette tax through our advocacy initiatives, it dramatically reduces the percentage of the population that smokes, especially the youth population when it comes to increase in tax or increase in cost. Access to screenings when it comes to our early detection initiatives is probably one of the most important things that we do, and we do that through our advocacy initiative as well. And we also do that just in partnerships with health plans. So if you look at any population, and if we're just going to take breast cancer as our example, if you look at any population, you've got two groups. You've got the group of individuals who have some type of health insurance or health coverage, and then you have the other group of population who do not have access to screening or do not have health insurance or coverage for any type of a screening services or for their health. And so if you look at those two populations, we have different approaches for each one. For those individuals who do have health coverage, they work for a company, we partner in our Great West Division with health plans. So that any type of a health plan, a group health, a Blue Cross Blue Shield, we partner with those groups, and everyone that they cover within their plan, so the multiple organizations that they work with, the multiple corporations that they work with, we partner with those health plans to message to individuals within the health plan that go out of compliance. So for example, you have a woman who maybe is 45 years old, and she has not in the last 2 years received a screening mammography. So we recommend as an organization that a woman receive a screening mammography every year at the age 40 and older. So she's 45, and for 2 years she has not received screening mammography, yet she has insurance and she's covered. So we really message and work with health plans to message to those individuals who become out of compliance. We do that through phone calls, we do that through emails with the company, and so we'll take a Blue Cross Blue Shield, and we'll take the group of women who have become out of compliance, and then we will partner with them to develop an appropriate message to their clients or their constituents who are covered to actually message to them to remind them that they have coverage and to remind them that they need to get an annual screening mammography. So we do big partnerships with health plans across the Great West Division and nationally to work with those individuals who are covered, who have insurance. And then we have the population who are uninsured. And that's really where our advocacy initiatives really focus on. So if we look at what we do with advocacy, so when it comes to breast cancer, when it comes to the Breast Health Awareness Program nationally, there's a federal program and also a state program that provides dollars for women who do not have access to coverage for screening and follow-up care. The American Cancer Society on the federal level, we lobby for dollars through our advocacy initiative to be placed in this fund, the Breast Health Awareness Fund, that then provides dollars to states to actually do screening and also do follow-up care for women within the states. And then also at the state level, our advocacy program focuses on state legislators, and we lobby for additional dollars to be placed in those funds to where more women can be covered and more women can have follow-up treatment as well. So through our advocacy initiative, we focus on the uninsured population to help make sure that screening and services are available for those individuals. And we focus on Breast Health Awareness Program, and then also through colon cancer program, we focus the same type of initiatives through those covered lives, through the insurance coverage as well, and also focus on health plans to help message to those individuals who become out of compliance. And then through our advocacy side, we kind of mandate that insurance companies in many states provide some type of coverage in their plan for those individuals for screening, for colonoscopy and colon screenings as well. Another piece that we've done recently is we've really grown a new initiative when it comes to our prevention area and early detection. It's our CEOs Against Cancer. And I mentioned kind of working with the insurance plans and working with those corporations, but we have CEOs nationwide, about 430 of them, who have signed on to partner with the American Cancer Society, and they commit to several things when it comes to helping people stay well within their company. So we partner with large companies, so CEOs of large companies who have a large number of covered lives on their health plan. So not just their number of employees, but also looking at the entire the employees' families and dependents that are covered under that health plan. And we do similar things with those groups as we go in. We analyze their current coverage that they have. We make recommendations if their insurance coverage might not really be in alignment with the American Cancer Society's recommendations. We also ask that that company provide some type of smoking cessation to their employees who do smoke, so provide some type of assistance with smoking cessation, as well as offer some type of an incentive or availability for them to either have on-site wellness activities, have some type of a gym membership incentive, but provide some type of incentive for those employees to have some type of a wellness activity or a gym membership that they would offer through the company as well. In return, those companies and those CEOs then work with the American Cancer Society on ways that they can make adjustments and make recommendations within their system to provide better access to screenings and also just provide a better health option for their employees overall. And helping people get well, the American Cancer Society, this is where really our base of services comes in. So we do prevention and early detection through our systematic ways of advocacy in corporations and health plans. And then we also, in looking at providing services directly in communities to patients as well. So within the Great West Division, we have over 30 patient navigator sites. Those are in-house staff that we place inside a hospital system. And we really focus placing those staff in the hospital systems that usually carry a high burden of underserved patients. So in looking at a hospital system that might have 1,000 cancer patient load a year, and a large number of those patients then are kind of what we consider underserved. And those underserved patients, it requires a lot more assistance for those underserved patients in order to look at transportation to and from treatment, and in looking at any financial needs that they might have, as well as just helping them navigate the healthcare system. So our Patient Navigator program truly helps patients navigate the healthcare system once they receive a diagnosis. We also have over 70 cancer resource centers in the Great West Division, and those are volunteer-based activities that we recruit volunteers who actually are on site at a hospital in our smaller facilities, and they actually then are there and kind of have the same hours that the treatment facility does, and they help those patients on a volunteer basis to navigate the system as well, as far as any resources or needs. We look at all the resources and needs, all the resources that a community has to offer, and then works with that patient on what they need, and then also try to connect them with our organization and other organizations as far as services go. We also have our website, cancer.org. It's available for any patient when it comes to looking at getting resources in their community, as well as our 1-800 number, 1-800-ACS-2345. It's available 24 hours a day, 7 days a week, and that's based out of our call center out of Austin, Texas. In the Great West Division, we served last year over 35,000 newly diagnosed patients. That's about 27% of all the newly diagnosed patients within our division. So we provided services to newly diagnosed patients, which a lot of our services are really focused on a patient who are newly diagnosed, those patients who are newly diagnosed. It helps them get right to treatment, helps them, again, with navigation services, with getting basic information on their disease, with questions to ask their doctor, as well as we have lodging programs that help individuals have a place to stay if they're traveling out of town for treatment. So a lot of our services are focused on those newly diagnosed patients, and so we have a big initiative. That's why we place our patient navigators and our cancer resource centers on site. So where those patients are coming, we're providing that connection for those patients there. We also provide over 70,000 services to caregivers, family members, and patients as well, but anyone who surrounds that patient and is assisting them, we also kind of provide services and information for that group as well. When it comes to other programs we offer, especially with cancer patients, we have nationally a lot of resources and connections as an organization, which enables patients to access what we have to offer, and it kind of opens doors for them nationally. So our Cancer Survivor Network is a way that patients can go online and they can connect with other cancer patients who have a similar diagnosis and share their stories and share their journey. And then also we have a unique service that's offered through our 1-800 number especially, and it's our clinical trial matching service. And clinical trials are kind of, for most patients, it might be their last round of hope. If they've kind of exhausted their local treatment options or local physicians, or they feel they've done what they can do for the patient, many times patients can enter into a clinical trial. And it's a research opportunity that almost every institution does in many ways across the country, any research institution. But a clinical trial is a special trial for a certain type of specific diagnosis in a certain type of patient. And those are kind of just research tests. And they're testing medicine, they're testing new treatment, and they'll take a certain number of cancer patients with that specific diagnosis through this trial to see if they can do better, have a better outcome than what they previously had. So what we do as an organization is we have an opportunity to work with the National Cancer Institute, and they give us the information on all the clinical trials that are happening across the nation. And when patients call our 1-800 number, they can be matched to a clinical trial that specifically matches their diagnosis somewhere in the country, and we connect them with those researchers working on that trial to see if they're eligible to jump into a clinical trial, which might be, for many patients, again, the last option that they have. We have many programs and services, a lot of Look Good, Feel Better program. It's kind of a program to where we provide cosmetic tips and wig tips and turban tips to women who are undergoing treatment, who lose their hair, all ran by volunteers of ours who are licensed cosmetologists. And other programs such as Reach Recovery, which helps women to connect with someone who's had a previous breast cancer diagnosis and has survived and is doing well in life, just to connect early on within their diagnosis, to know that there's hope out there for individuals once you get diagnosed with cancer. We also do things mentioned as far as really providing access to care. So again, once someone's diagnosed, the most important thing is to get through their treatment regimen. If they can get through their treatment regimen, their chances of survival and just of overall just good health is just really has increased dramatically if they can just follow the treatment regimen that's outlined by the physician. So we provide lodging. We partner with hotels that provide places for people to stay if they're traveling from out of town for treatment. And in a couple of our cities, in Phoenix and in coming soon in Salt Lake City, we have a Hope Lodge, to where it's an American Cancer Society facility, kind of like a Ronald McDonald House for Cancer Patients that we provide as an organization. We also provide transportation assistance in many communities. So we have a road recovery program to where we recruit volunteers who actually provide transportation to local patients needing treatment, as well as those from out of town as well. When it comes to finding cures, to me it's probably one of the most important, significant things the American Cancer Society does, and it's really our research program. So we have two major research initiatives. One is our internal research program, the Cancer Prevention Study, to where we follow thousands and hundreds of thousands of people over the course of their life, and they sign up for the study, and we do surveys with them regularly. We find out what they eat, how much they exercise, what do they do on a regular basis, and then we follow that same population and see which of them have a cancer diagnosis throughout their lifetime. So it really ties behaviors to outcomes of getting cancer or not getting cancer. So the Cancer Research Study, Cancer Prevention Study, we're on our third one nationwide, and Cancer Prevention Study 1 actually made the connection between smoking and lung cancer, and Cancer Prevention Study 2 actually made the connection between obesity and cancer as well. So we're just now recruiting individuals for our third study, Cancer Prevention Study 3, and we'll be recruiting 300,000 people across the United States to participate in the study, and we'll follow them over the next 20 to 30 years to find the next risk factors for cancer. That's our internal research program. Externally, the American Cancer Society funds research to individuals and institutions across the country. So twice a year, we accept research applications, and we fund into a unique gap in the research program. We fund new young investigators who are right out of school, well-trained, have great ideas, and really need funding just to get started. It's one of the hardest things is once you kind of get through school, it's really getting your first funding secured so you can actually focus on the research you want. So that's a big gap in the program. So the American Cancer Society twice a year takes applications, and we get volunteer scientists who are top in their field who rank those applications from outstanding to, I guess, poor. And then we start applying funding that we have, all the funds that we've raised throughout the year, we start applying the funding to those top grants. And right now we're able to fund about, of the outstanding ranked applications, we're only able to fund the top 15%. So about 85% go unfunded, and those are the outstanding ones at this point. But of those that we funded in the past throughout the years, into this research gap of new young investigators, 44 researchers have gone on in their career to win the Nobel Prize in Science. So it's a critical funding gap, and it's really one of the best things I feel the American Cancer Society does is our external research program to fund researchers and institutions across the country. So a lot of times as working out in the field and working with volunteers, I think it's really important as staff and or volunteers to understand the importance of being a national organization. Many people shy away from that. They want to talk about everything local, and a lot of our volunteers and donors, I think they want everything to be and stay local, but I think it's important as a staff person that you're really able to talk a broader picture, and our volunteers also as well. So if you look at what our national piece of what we do provides, and how we should be very proud of being a national organization, is one is our 1-800 number and website. All that is administered and done through the national office. So it provides individuals in any community a chance to connect to information and services 24 hours a day, 7 days a week. So that is all provided from being a national organization. Also, we have really unique national partnerships that we could not have if we were not national. The Center for Disease Control, any of our federal advocacy initiatives and partnerships that we do. We partner with American College of Surgeons. That partnership requires any hospital, in order to be accredited by the American College of Surgeons, to partner with the American Cancer Society or work with the American Cancer Society on patient navigation services. So if we weren't national, we could never have partnerships like those initiatives. And it also allows us to get major foundation support. So recently, the American Cancer Society International received a $7 million grant from the Bill and Melinda Gates Foundation. They only fund big partnerships, and they do not fund just local small initiatives. So by being big and being national and really focusing international as well allows us to really garner support from large foundations. They know a gift to us can impact people in all communities across the United States and around the world. Also, being national provides us an opportunity to fund our research program, as I mentioned. So if I look at our national research initiatives, we don't just fund in one city. We'll take dollars from California, apply them to a researcher in Seattle, and then we've seen that researcher then go on to win the Nobel Prize in Science. So a good example of that is by garnering research dollars nationwide and putting them to the best and the brightest nationwide. Several years ago, we partnered with the Disney family out of California to fund a new researcher here, Mary Claire King, in the Seattle area. And Mary Claire King actually made the connection between the genetics of breast cancer. The BRCA1 and BRCA2 genes all were developed by Mary Claire King by funding that we garnered from other areas across the country to apply here. Being national also is important when it comes to looking at communities in crisis. And so one is a good example is Hurricane Katrina. Whenever Hurricane Katrina and or Hurricane Sandy even more recently, Hurricane Katrina went through the New Orleans area. Every local organization was out of business. Every local research facility was underwater. And as a national organization, we were able to garner our volunteers and staff in those surrounding states. And we actively went into the evacuation sites, and we were able to pull individuals who were in active cancer treatment. Now you have to realize these are people that normally were going through cancer treatment, and then a hurricane comes in, and all of a sudden everything they know as far as their home and their treatment facility is out of business and underwater. So as an organization, we were able to go in and actively go into evacuation sites and pull individuals who were in active treatment out of those evacuation sites and get them to a surrounding facility in another state so they could continue their treatment. If you remember earlier, one of the things I said is most important is once a cancer patient's diagnosed and they're in active treatment, to fulfill their treatment regimen is one of the most important things they can do for survival. So those are the things that we do. Whenever there's floods in North Dakota, whenever there's another hurricane in New York, we rally our support around those areas, and we're able to go in and assist when other organizations are out of business. So being a national organization, it's truly important when it comes to fighting a major disease. It allows us to provide research funding nationwide, wherever the best and the brightest are. It allows us to, anywhere you live, have a 1-800 number and website that you can access to get information, questions for your doctor, talk about your disease, and then also on a state of crisis, it allows us to step in and keep services and information flowing for those cancer patients who are undergoing treatment. The last piece is our opportunity to fight back. I think many ways, as staff and even as volunteers, we kind of shy away from asking people to get involved. And we think, oh my goodness, I can't ask for someone to volunteer and give this much of their time. I think it's really important to remember that what we're doing is offering people a chance to fight back. My mom was diagnosed a couple of years ago with Alzheimer's, and there's nothing, she lives in Texas, there's nothing I can do living here to support her other than, phone calls and go visit, but what I want to do is I want to get involved in Alzheimer's here, which allowed me a chance to fight back. I'm raising money for them, I serve on their different committees that they have, but that enables me a chance to fight back against the disease that my mom's dealing with, and I want you to look at the same thing when it comes to what you do with the American Cancer Society. You give people a chance to fight back. Either someone that they've lost in their past or someone that they're dealing with now that has a cancer diagnosis. They might not even be next to them or near them, but you give them a chance to focus their time, energy, and effort to fight back against the disease. So we do that through all of our volunteer activities, through our advocacy initiative, through our special events, the Relay for Life, becoming a participant in the cancer prevention study. All those things and initiatives really allow people a chance to fight back. So overall, as a staff person or volunteer for the American Cancer Society, we provide, everything we do focuses on helping people stay well, get well, finding cures, and fighting back. Thanks.